Profesional kesehatan medis asal Belanda, Madeleine van Rijkevorsel, telah mengunjungi Papua Barat secara rutin antara tahun 2010 hingga 2017. Dalam buku terbarunya berjudul Papua Insight, Barriers and Beyond tahun 2023, ia mengungkapkan situasi terkini di Papua Barat serta akar hukum dan sosial politik dari konflik panjang yang telah berlangsung lebih dari 6 dekade antara orang Papua Barat dan negara Indonesia. Buku ini menyajikan pandangan mendalam tentang dampak dari konflik yang kian memburuk di wilayah tersebut. Dalam pengantar bukunya, van Rijkevorsel menyebutkan bahwa situasi yang terjadi kini semakin dibayangi oleh blokade pemerintah Indonesia terhadap media asing dan organisasi kemanusiaan. Hal ini menyebabkan salah satu konflik subnasional yang paling tidak dikenal dan paling lama tidak terselesaikan di kawasan Pasifik semakin memperburuk keadaan. Selama lebih dari 60 tahun, bekas koloni Belanda yang kini menjadi Papua Barat, bagian barat Pulau Nugini, telah mengalami penindasan yang dilakukan oleh pasukan keamanan Indonesia dan perlawanan dari penduduk asli Papua. Pelanggaran hak asasi manusia yang meluas dan hasrat untuk menentukan nasib sendiri telah memicu kerusuhan yang tidak kunjung reda. Militerisasi yang terus berkembang, meningkatnya pertumpahan darah, serta tingginya jumlah pengungsi internal menjadi ciri khas situasi saat ini di wilayah tersebut. Van Rijkevorsel, yang memiliki latar belakang medis, memperkaya pengetahuan kita tentang kondisi di Papua Barat dengan pengalaman langsung yang dikumpulkannya selama perjalanan dan penelitian lapangan. Melalui buku ini, ia tidak hanya memberikan paparan mengenai kompleksitas akar sejarah dan sosial politik dari konflik tersebut, tetapi juga mengadvokasi pentingnya intervensi, baik secara nasional maupun internasional. Buku ini juga menyoroti kesulitan yang dihadapi oleh masyarakat Papua Barat, yang terjebak dalam pertempuran antara pasukan militer Indonesia dan kelompok-kelompok perlawanan. Diskriminasi terhadap etnis Papua, serta jumlah pengungsi yang sangat tinggi, semakin memperburuk kondisi kemanusiaan di wilayah tersebut. Dalam wawancara dengan West Papua Women of Week di Australia, terungkap bahwa perempuan Papua memainkan peran penting dalam perjuangan kemanusiaan ini, meskipun mereka seringkali menjadi korban dari kekerasan yang terjadi. Van Rijkevorsel berharap dapat meningkatkan kesadaran internasional tentang pentingnya perhatian terhadap Papua Barat, serta mendesak adanya upaya untuk mengakhiri konflik yang telah menelan banyak korban jiwa ini. Buku ini bukan hanya sebuah karya penelitian, tetapi juga sebuah panggilan untuk tindakan yang lebih besar dari masyarakat global. Buku ini menyuarakan kebutuhan mendesak akan solusi yang lebih inklusif dan berkelanjutan untuk menghentikan kekerasan dan membuka jalan menuju perdamaian yang lebih permanen bagi masyarakat Papua Barat. Berikut ini adalah wawancara West Papua Women of Week Australia dengan Madeleine van Rijkevorsel.
Good evening, Madeleine. Congratulations on the publication of your book, which I will show everybody. It's such a wonderful book about West Papua from your journeys in there over a long period of time, where you investigate and report on the political and social situation in West Papua these days. So I just wonder if you could tell us a little bit about where you went in West Papua and what you did.
Okay, thank you, Louise. I was in West Papua 4 times between 2010 and 2017 for periods of 1, 2, or 3 months. The first trip started as a tourist vacation, and I spent later trips researching healthcare. The idea to do research started that first year when I saw how scarce and bare and almost non-existent the basic services for healthcare were in some remote Papuan villages. I'd also read about high infant and child mortality rates and high maternal mortality rates in West Papua, higher than in other provinces in Indonesia. And since this had been my line of work in the Netherlands, I decided to research mother and child health care. I wanted to see if and in which way I might be able to help to improve the health care. To start, I needed to learn more about the social and political structures and systems in Papua and Indonesia and the cultural traditions in Papua. Right. I'm a public health professional, and that's what public health entails, the broader picture. It's not just about, for example, medical treatment for malaria or TB. It's also about accessible health services following minimum norms, even in low-resource countries. So I traveled a lot. I traveled from north to south and east to west. I traveled from Manokwari in the northwest to Merauke in the south, and to Sorong and to Abipura near Jayapura. I was also in Timika, the town which is associated with Freeport Mine. Mm-hmm. And I stayed in a transmigration settlement in the northwest, and in rural villages, also in the northwest, and also in Papuan villages in Upper Digu, near the border with PNG, with Papua New Guinea. Yep. I stayed with missionaries, for example, at a high school together with the teenagers, and at a town monastery, at the breakfast table with the friars, and I stayed with Papuan families in their homes. I think I spent only 7 days in a hotel in all those years.
Right. So you got around, met a lot of people. Did you work on certain projects?
I had one official project, which was in collaboration with the district's Department of Health in the south. And I was studying the Posyandu. And the Posyandu is a grassroots standard program and monthly sessions for pregnant mothers and babies and young children in villages and town wards. It's offering preventive health care. I also worked on 2 other Posyandu projects with the province, with the Department of Health at the level of the province, but both of these were either delayed or discontinued because of financing. But I had my own project. I was researching the Posyandus also in other places, and I was learning about the politics and the social situation in which people live. I was invited to visit all sorts of healthcare services and clinics, also a private maternity clinic, or a home for handicapped children run by nuns, or pediatric wards in hospitals, and so on. I tried to make an inventory of the foreign NGOs with mother and child health care programs in Papua. And this is where I was surprised. This is where I heard about the tall wall set up by the Indonesian government. Many international NGOs had been banned from West Papua. Even the International Red Cross had been forced to close its doors in Jayapura in 2009. And this policy supplemented the ban on foreign journalists and UN diplomats who are also have no access to West Papua. And this was all different from Indonesian policy in other provinces, where many more international NGOs were active and the borders weren't blocked. It was all quite discriminating against West Papua, if you ask me. Mm-hmm. But I could travel, and I saw how the healthcare system faced many obstacles. To start with, West Papua is huge. A lot of people don't realize how huge it is. Maybe in Australia you do, but in other countries in the world, people don't realize it. There are hardly any roads either. Right. That's different than Australia, and different than Africa also, in my opinion. Okay. Many remote places are only accessible with a small airplane. It's costly and complicated to travel, for people to get to a health center, for staff to get to the villages, or to transport supplies. In southern Papua, I heard a typical story I want to tell you. A man told me about healthcare in a swampy region along the coast. And now I'm going to read his quote. He told me, "It's just too far. It takes 200 liters of petrol and a huge boat by sea to get there. and 200 liters more to go to the villages. There's no water or electricity, so teachers and paramedics and government people just stay a year and leave again. No one feels responsible. No one feels the bond. The locals are not educated. The Puskesmas, that's a community health center, workers do the rounds and go to the villages 2 to 3 times a year, which is not frequent enough. But then people don't know when they are coming and are not there. They're off to the gardens in the forest, as they do every day. Well, this is a typical situation: poor living conditions and outsiders not feeling responsible and not feeling the bond. A lot has to do with governance and how things are organized. I noticed that the implementation of this one standard Posyandu program, is quite standard program, was different in each location I visited, even within one district. And a lot seemed to depend on the local leaders. This could be the Papuan village head, or the leaders who were the people who were officials in the district and sub-district government offices, and many of these people, civil servants in higher positions, are non-Papuan migrants, Indonesian migrants, and I sometimes wondered how much discrimination played a role. They just couldn't care. They didn't. They neglected the remote areas where it was complicated. But maybe not. Maybe it was only the problem of the complicated logistics. I did see that primary health care services in the transmigration settlements and in villages with migrants were often better, with more and better staff and supplies.
Okay.
Apparently, also the budget for healthcare and education is not well earmarked, and money gets spent on other priorities. In any case, some remote and sparsely populated areas where mainly Papuans live really need extra attention and tailor-made programs. But the politics influences the health of Papuan people in other ways, too.
So what do you mean by that? What other ways does politics influence health?
Well, I'd like to talk about a really urgent and current situation, if I may.
Yes, do.
The political decisions of the Indonesian government in the past 60 years, for years, and to this very day, to choose the so-called security approach to deal with the conflict between the indigenous Papuans and the central government is very detrimental to Papuans' health, physically and mentally, and also detrimental to Papuans' well-being. The Indonesian government chooses military repression instead of the humanitarian approach, and this strategy is counterproductive. Since 2018, that was after I had been to Papua for the last time, but the armed conflicts between indigenous Papuans and the Indonesian army and police in 6 to 8 conflict zones are escalating. And therefore now there are more than 80,000 IDPs, or internally displaced persons, so internal refugees within Papua. Most have no access to health care. I think there was a percentage of 87% or something, and they don't have enough food. Pregnant mothers and young children and elderly are especially vulnerable. It's a huge humanitarian crisis. To quote, based on a recent report written by a group of churches, I'm quoting, "There's no organized Indonesian domestic humanitarian response to this crisis. And Indonesia actively, so Indonesia, the central government in Jakarta, actively prevents any international humanitarian access, even by the International Red Cross. And this is a thoroughly exceptional and outrageous situation." And these are all political choices. So, and the negative effect of Indonesian police and military can also be seen in communities where they are guarding extractive industries, So everywhere there are extractive industries, there is police and military, or guarding new concessions, which are encroaching on traditional land. And the intimidation and the threats and the physical violence make people feel unsafe and feel fear. And the same happens when peaceful demonstrations are broken up, when meetings about laws such as the special autonomy law are blocked, or people unlawfully arrested, or unlawfully imprisoned, or even tortured. So when human rights are violated. So to end, I would say, let's hope for the political will of the Indonesian government to embrace more of a humanitarian approach instead of the security approach and the increasing militarization. They need to address the root causes of the conflicts. Let's also hope for the political will to act now to alleviate the plight of the Papuan refugees, the IDPs. And finally, let's hope for a multi-ethnic society in West Papua, a society with justice and peace instead of fear and violence. Thank you for your attention.
Thank you, Madeline. That was a wonderful interview. If anyone wants to get in touch with you, they can contact her, Madeline, through the West Papua Women's Office in Melbourne. I'll put the link below this video. And through that same link, you can also buy Madeline's wonderful book, just new published this year, and we've got copies in Melbourne, or you can buy them if you contact Madeline. If you're in Europe somewhere, you can get them from her as well. Thank you, Madeline, and we hope to see you in Australia next year.